Kenya Progressive Nurses Association has observed the going on around coronavirus and the response by the powers that be concerning this deadly disease, and wish to state as follows. Whereas coronavirus has been declared out of control in China, and there are worrying outbreaks in various countries, including South Korea, Italy, and Iran, the Kenya government does not seem to notice this, to an extent of allowing Chinese flight into Kenya and not taking necessary steps to quarantine those on board. This means that if in case any of them was under incubation period, we may experience outbreaks also in Kenya. The first contact to those who may develop the disease are nurses. This will mean that many nurses will be working long, stressful shifts, during which they are exposed to a great deal of human suffering and the disease itself. As things look, as nurses, we are concerned about the availability of personal protective equipment for nurses who may work in close contact with infected patients. No nurse or healthcare worker has been trained to deal with this menace. We will continue to monitor the situation to ensure that nurses are not put at risk during the course of their work. We also wish to remind nurses about looking after themselves and the importance of teaching their patients and colleagues about good infection control and the need to take care of themselves if there is any chance that we could be at risk of contracting this dangerous infection. Simply and more effectively, hand washing. Nurses are frontline officers in healthcare and may also be frontline to exposure to infection, and are also frontline of defense in the fight against this new and deadly virus. We ask our government to provide nurses with the vital resources and training they need in the kind of situation we may get into. The authorities must work round the clock to prevent and prepare for any eventuality at a public health scale. It's only sensible that we should start preparing ourselves as at individual and government level for the arrival of the new and dreadful virus. This will ensure that we are not taken by surprise, because if so, the outcome may be more catastrophic. I therefore call upon all nurses around the country and the globe to be vigilant and to ensure their environment are safe and free from the deadly virus, and take all precautionary steps to limit contracting and the spread of the virus. Nchi kama Amerika zimezuilia ndege kutoka China kuingia pale. Na kwa mambo ya matibabu, Marekani iko mbele sana kuliko Kenya. Na ijapokuwa wako mbele sana, lakini wameamua kukataa ndege za China kuingia pale, kwa sababu hawangependa janga hili kuingia katika nchi hiyo na kuweza kuwadhuru wananchi wa Marekani. Lakini jambo la kushangaza ni kwamba katika nchi hii yetu ya Kenya imeruhusiwa ndege kutoka China kuweza kuingia katika nchi hii, ili hali tunafahamu ya kwamba hata katika nchi ya China serikali imetangaza ya kwamba wameshindwa na janga hili, na nchi zingine pia zimepata shida kwa sababu ya janga hili, kwa sababu hata kwao imeingia. Langu hivi leo na kwa niaba ya chama chetu cha wauguzi ni kwamba ni kuuliza serikali yetu ya Kenya iweze kukomesha ndege za China kuingia nchi hii haraka iwezekanavyo. Na jambo la pili ni kwamba lazima wauguzi waweze kupelekwa training kwa njia ya kuchukua tahadhari, ili kwamba janga hili litaweza kuingia, wauguzi wawe wako tayari kuweza kukabiliana nalo. Jambo la tatu ni kwamba lazima tuweze kuwa na vifaa vya kutosha vya kuzuilia maradhi haya ya coronavirus. Kwa hiyo ni kwamba nchi hii na ministry yetu ya afya lazima waweze kufikiria ili ya kwamba wapate nafasi ya kuvinunua vyombo vya kuweza kuzuilia maradhi haya, ili ya kwamba iwapo yataweza kuingia katika nchi yetu tuweze kuwa tayari kukabiliana nayo, kwanza kwa vyombo vya kukabiliana nayo, na pili kwa kuweza kuwasomesha watu, kwa sababu janga hili ni geni na halijakuwepo. Hivyo hivyo ni kwamba wananchi wa Kenya, nataka kuwarai ya kwamba nao pia wapike kelele, maana rais wetu tangu janga hili liweze kuanza na watu waanze kuzungumzia coronavirus, rais wetu pia amefanya nini? Amenyamaza. Mimi naomba ya kwamba angelitoa amri ya kusema ya kwamba mambo haya ya ndege kutoka China yakome, ili ya kwamba nchi yetu iweze kuzuia maradhi haya kuweza kuingia hapa. Na kwamba pia wauguzi wenzangu, nataka kuwaomba ya kwamba mchukue tahadhari, kwa sababu msipochukua tahadhari janga hili ni hatari. Na janga hili mmeona kwamba kule China watu wengi wamekufa na hujui nani atakayekufa kwa janga hili. Hivyo ni kwamba wauguzi, chukueni tahadhari ili ya kwamba muweze kujiponya, na kama hospitali yenu haijajiandaa, naomba ya kwamba mkiona virusi hivi vya coronavirus kimbieni, kwa sababu ni hatari na itaweza kuwadhuru, na hakuna matibabu hata kule Marekani, hakuna matibabu hata kule China, hakuna matibabu hata kule Europa. Hivyo ni kwamba njia pekee ni kwamba mkuu niponye, ili ya kwamba uweze kuwa na nafasi ya kuweza kujizuilia. Hivyo ni kwamba lazima hospitali na nchi mzima uchukue nafasi ya kuweza kurudisha watu katika workshops ya kujifundisha jinsi ya infection prevention, ili ya kwamba iwapo itatokea kwamba iko Kenya tuweze kuzuilia jinsi ambavyo iwezekanavyo kwa ajili ya kukabiliana nayo.
Call upon Joseph Makambora to open with a word of prayer.
Which are going to give us guidance into what we are supposed to do. Let us not.
Throughout the week, allow me to invite the quality manager to.
Okay. Honorable guests, all colleagues and friends, good morning. Good morning. I'm Patient Safety Manager of the Khan Hospital Kisumu and its clusters for some time. We as a Khan Hospital, in totality, we believe, as Lynette has told you before, we had a walk in Kisumu just to express to the community that the others that want to embrace and of course increase the level of quality, and any other person together with the staff. That is a safety that we are looking at. Patient safety, we went into a quality standard that actually, because this is an outreach center, one of the clusters, it's like it wasn't possible for us to come to this level. The efforts that you did, because it wasn't very easy. Put a hand for that. And it was not in vain, because people struggled. People put things together and we managed. And hopefully Western in Kisumu. But not forgetting our Kisi Medical Center. We are also
we have 12 outreach centers. We stretch all the way from Kitale to Narok to Migori. Our plan is to go for safe care accreditation in the next 2 to 3 years. And even as we do that, working very closely with every county.
We have reached over 2,000 facilities in terms of implementing healthcare standards. It's about standardizing in terms of safe care, timely care, efficient, effective, patient-centered care. Aga Khan Kisumu has taken a bold leap. Aga Khan Kakamega, the network, has taken a bold leap to say we want to provide safe care to the citizens that we serve, and they're going to take and world-class care is something that they're not going to compromise. So we commend them, we celebrate them for taking this bold leap and setting an example for healthcare facilities in Kenya to say put our patients first, and safety is something that we're not going to compromise.
For us, the cluster means the outreach centers that we've been able to develop so that we can be able to create access as a measure towards having an integrated health system and be able to promote the health services and taking care of healthcare services to the communities that we are situated in. Today we are here in the Kakamega Medical Center to celebrate a very important milestone for us. The milestone being having achieved safe care accreditation, which is a quality accreditation that we have been working in partnership with Farm Access. It is a stepwise accreditation that has brought us this far. Aga Khan Health Services Kenya and Aga Khan Hospital Kisumu as an institution subscribes to providing quality services to our clients, and for this reason then the management has been able to invest and commit to making sure that we journey towards providing quality services. We've had audits that have been done, we've journeyed together, and today we celebrate a milestone that has been able to put us in the limelight as one of the first private institution achieving safe care level 5 in this region. For this specific accreditation today, our partnership has been with Farm Access so that we can be able to attain the safe care accreditation. But clearly, as Aga Khan Health Services Kenya and in this place, Aga Khan Medical Center, it's not possible for us to work on our own. So we work very closely with the Ministry of Health. We work very closely with the partners that provide healthcare services in this region for us to be able to provide the quality healthcare services that we are looking at. And because the medical center is an outreach center under the Aga Khan Hospital Kisumu, then they look at us for referrals for inpatient care. From the moment that it was made as an alert through the WHO, Aga Khan Health Services Kenya has been screening patients, any person that walks into their facility, whether it's a visitor, whether it's a patient, whether it's a relative, whether it's just somebody that's passing by. We have been able to screen them, and there are specific measures that we are looking at, whether you have a history of a cough, whether you have fever, whether you have a history of travel or have been in contact with somebody that has been able to travel. And as soon as that is done, we are able to tell whether you are being exposed and set you apart for isolation if need be, so that we can be able to screen to rule out if there is if you are infected with coronavirus. Fortunately, and we want to thank God for this, that we have not had any case of coronavirus in this region. The staff are fully aware about the virus. We have had to go through the inpatient infection prevention committee to be able to alert the staff. We have been able to educate them. We have been able to set policies and bring checklists so that they can be able to use to be able to screen out any person that walks in, so that they can be able to identify that person. Additional to that, we have been able to work with other AKDN agencies and also be able to visit the corporates to create the awareness, just to demystify the old information that has been going around about the coronavirus.
I want to recognize the partners you have worked with, Farm Access. We are also working with them on they are supporting our universal health coverage by giving some of our citizens NHIF, and we believe now we can move a step further and look at safe care besides the other areas where you are. So we want to declare Aga Khan a safe care hospital. Can we clap?